Well, it is official. The government shutdown is now in effect. Around 750,000 federal employees will be furloughed until Democrats and Republicans can agree on a spending bill.
Joining us now is Kitty Richards, Senior Strategic Advisor at Groundwork Collaborative and former Department of Treasury official. Welcome.
Thanks for having me.
Government shutdowns are not uncommon. What is different about this one, do you think?
You know, it's funny, we didn't used to think of government shutdowns as a common occurrence, but it's true that over the last 15 years, we've seen them happen a number of times. And I think the really key thing to remember about this is that today, unlike in many past shutdowns, we're not just facing a government funding cliff, we're really barreling over a healthcare funding cliff. And that's what we're really focused on as we think about the bigger picture surrounding this shutdown.
So one of the main sticking points here, Democrats say a bill introduced by Republicans will make it harder for Americans to afford health care, and they're refusing to support it. Walk us through what's really happening with this bill, as Republicans are saying that Democrats want illegal immigrants to have medical funding.
Republicans control the House, the Senate, and the presidency. And over the summer, they used that power to pass on a party line vote a deeply unpopular and really problematic set of tax cuts for the wealthy, partially funded by steep cuts to Medicaid for everyday Americans. In the same bill, they set up this healthcare funding cliff by kicking the can on some really crucial subsidies that keep the Affordable Care Act exchanges running for millions of Americans. And so what we're seeing is all of those things coming together. And on November 1st, if nothing is done to address this healthcare crisis, we're going to see premiums skyrocket for Americans on the exchanges. And then over time, those Medicaid cuts are also going to make it hard for hospitals to stay open and start to hit the pocketbooks of everyday Americans. So the healthcare bill that the Democrats have proposed, the funding bill that addresses those problems, would keep premiums low on November 1st, when otherwise open enrollment starts and people are going to start to see hundreds of dollars a month in increased premiums. And you can't roll that back once it's happened.
President Trump threatened mass firings of federal workers if this shutdown happened. What do you see going forward? I
want to make clear that a shutdown does not give the president new dictatorial powers over the civil service. The shutdown is going to cause the furlough of a lot of federal workers, and that's going to cause hardship, and we should really, take that seriously. But all of Trump's claims that he's going to use this as an excuse to do more mass firings, that is not the way that a shutdown works. And if there are mass firings, they will be done exactly the way that they have been done over the last few months, with questionable legal authority, and the shutdown will just be an excuse.
Can we ask how this is going, this partial shutdown, how it's going to impact everyday Americans?
Nobody wants a shutdown. This is going to mean that national parks aren't open, that certain services are not going to be provided in a timely manner. That's a problem for our economy, and it's really a problem for the federal workers, some of whom will have to continue to work, but many of whom will go without a paycheck until the shutdown is over, impacting their families and their communities. These are people who provide necessary services, often at lower wages than in the private sector, and they don't have a huge cushion. But it's important to remember what the stakes are for everyday Americans of continuing to kick the can on this healthcare crisis.
Kitty Richards, our Senior Strategic Advisor at Groundwork Collaborative and former Department of Treasury official, thank you for taking a few moments for us this morning.
Thank you.